Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. As you know, every week I have a different guest on my program, and we talk about different services and programs that we offer here at KRMC. I've got an exciting guest on the program today, so stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Dr. Nisha Manek, a new rheumatologist here at KRMC. Thanks for being on the show today.
Oh, I'm delighted to be here, Jamie. Thanks for having me.
Well, and it's exciting to have you here in Kingman. Yes. We have so needed a rheumatologist, even though I have to be honest, I can't even say that I know everything a rheumatologist does, so I think you're going to educate me.
Well, let's educate you, Jamie.
Okay.
Well, a rheumatologist is a specialist that deals with arthritis, all kinds of joint disorders.
Okay.
But under that umbrella of joint disorders is autoimmune diseases. What we mean by that is that the immune system is very complicated, and in some people it becomes sort of dysregulated, and you can get other diseases like lupus. Lupus is a frequent condition that I see. And then it goes all the way to the bread and butter joint diseases like gout or osteoarthritis due to aging and so on. So we cover a lot of scope, if you will.
Sounds like it.
Yes.
And I think you're going to not be bored for lack of patients in Kingman.
No. I've been delighted so far. I've been here just a few weeks. This is my third week in clinic, and I've seen a lot of very interesting patients coming from all over the surrounding areas. And I'm hoping that over time we will build a very robust practice of rheumatology, which really is very interesting, really, for me and for the patients. They clearly need a specialist here.
I know that when we first heard that we'd finally found a rheumatologist, and I started sharing with people out in the community, they were so excited just to have you here. So that's wonderful.
It's not well appreciated. I think in American public health care, we have focused our energies on heart disease and cancer, but it turns out that joint diseases or arthritis is the #1 reason that adult Americans have disability. And that's the monies that we spend in caring for patients with arthritis is huge.
Wow.
So we really need good specialty care. And rheumatology has become more and more complex. It's not just family practitioners or internal medicine. You really need specialist care. So I'm very pleased to be here.
That's wonderful. And now, just so the audience knows, you're here 2 weeks a month right now.
That's right. Yes.
So it's like every other week?
That's
Is that how we're doing
That's
it?
right.
Okay.
Yes.
And then I understand in those off weeks, you're on a busy project.
Well, yes.
You're not like taking vacation time in between.
No. And I was at Mayo Clinic for many, many years. I was on staff in Mayo Clinic, Rochester, Minnesota. And one of my interests is complementary and alternative medicine. And I was one of the few rheumatologists who are a graduate of the program at University of Arizona in Tucson, so Andrew Weil's program. And in fact, I'm a clinical instructor, and I write the rheumatology program for the fellowship there. Now, in that studying, I was invited to write a book chapter for energy medicine. Well, these are therapies like Reiki or acupuncture in the broad scope.
Right.
And in my investigation for that book chapter, I became aware of this very interesting man. His name is Bill Tiller. Professor Bill Tiller. He's a professor from Stanford University. He's retired in Scottsdale. So I looked into his work, which really dives into energy medicine and what he calls information medicine. Well, I found this very interesting as I wrote the book chapter. So I approached my division chair in Minnesota and said, I'd like to look into this a little bit more, because it's obvious that a lot of our patients are using them, and we need to understand them a little bit more. So they were very kind and gave me permission for 6 months to do a sabbatical. And in that time, I began to understand the physics behind energy, the physics of
that's
information
exciting.
theory. And it's a rare area. And when Bill Tiller said, yes, I will mentor you, I mean, the choice was made. I went
Yes.
back to Minnesota, and I really, it was a really tough decision. Do I leave Mayo Clinic and come to Arizona? And I decided that would be a good thing for me to do. And that's why I landed in Scottsdale.
Okay.
And along the way, I decided I really want to do rheumatology as well. So there's a balance from research and clinical medicine. And I'm very glad that Kingman gave me that opportunity.
It's working
that, you
well
know,
for both.
do the part-time, and we'll give you the time to go back to Scottsdale and keep that alive. So it's always a balance, and I think Kingman was the right fit there.
Excellent. Well, and I think we'll benefit
Yes.
because I don't know, has anyone shared with you what we're doing here with CAM?
Tell me
We
more.
have the complementary alternative medicine. We have a subcommittee of the KRMC Foundation
Okay.
that has been doing some fundraising,
Oh.
and we provide scholarships, if you would, to help
Okay.
pay
Yes.
for acupuncture, chiropractic,
I
massage
see.
therapy, things like that that aren't, mainstream,
Yes.
if you would.
I'd like
healthcare.
to find out
So
more.
you and I are going to have to talk more, and I'll put you in
Yes.
touch with the right
Yes,
people.
yes.
They'll be very excited to hear that you're working on that.
You know, I think healthcare in America is going towards that individualized medicine. We realize that one size does not fit all. It's not a cookie cutter approach.
Right.
So I think the complementary therapies, we begin to open up the conversation as to what makes what is the right thing for an individual patient? What are their individual goals? And I'll give you an example. Already today I've seen 2 patients who have chronic pain symptoms, and they have excellent conventional care. So they come to rheumatology to be sure there's no rheumatic disease or inflammatory condition. Now we have to open up, what have you done in the exercise? What have you done in the supplements? What have you done in the mind body? What have you done in even in the spiritual aspects? These are all part.
Whole body.
It's whole body. It's mental, physical, emotional, and spiritual well-being.
Yeah.
I think all of those are components.
Right.
Yep.
Well, and I'm so excited
Yes.
that you're here
Yes.
and that you have that
Yes.
kind of openness.
Yes, oh, absolutely. Yes.
That's wonderful.
And a lot of this, is getting more and more respect. A lot more evidence is being gathered. And I think over time, Kingman is in a very good position here. I think not only because it has an integrated approach, we talk to each other. I mean, I talk to other physicians here, and we make a
team approach.
comprehensive approach. Yeah, each one has their own training, and we give a unique perspective to a particular condition. And I think Kingman that way has the integrative approach like Mayo Clinic, but it also has innovative approaches. Here we are in a fitness center that can really do innovative approaches. And they have the platform, not only the studios, the cooking classes, the fitness equipment, meditation could be introduced. There's many things. I know there's yoga and Tai Chi here already.
We do yoga, right?
Yes, and I think these are things for me as a rheumatologist that I always prescribe, and I introduce my patients who are not familiar to those things. I think it's really important to have choices.
That's wonderful. And like you said, here at KRMC, we have those choices available, or those opportunities available for them.
And I think Kingman, with its proximity to Bullhead City, to Laughlin, to Vegas, we can start really attracting patients from all these areas, because we, again, are very unique that way. And this is really a cool opportunity for us to become robust.
Very exciting. And that partnership that we have with Mayo, which has helped us find physicians like yourself, as well as give us more of the video conferencing to be able to work with physicians in Phoenix and in Rochester that we can't, for those specialties we don't have here. So we're just blessed.
When I came to Kingman, and I must admit, I didn't know where Kingman was. I didn't know. I had many opportunities in Phoenix, and it was really, in a sense, a curiosity. And when I came here, I was absolutely stunned. Their radiology department, many of the physicians are from the Mayo Clinic, so they bring a mindset that's rigorous, that's thorough, but also very compassionate. Mayo's theme theme has always been the patient's needs come first.
Right.
So how do you really deliver care that is compassionate but also rigorous, evidence-based, and be consistent throughout? So I was delighted that there are many people that have the same sort of training as I did, who came from the same
Mindset.
system I
Yes.
did. And not only that, as you said, we don't always have all the expertise, and I can't claim that I know everything about everything, but I know where to look.
There you go.
And I do know who to ask.
Right.
And I respect the Mayo Scottsdale very, very deeply, so I'm
Right.
very delighted that we have that association. I think
Absolutely.
it benefits everyone.
Yeah, absolutely. I know when we were first asked to join the Mayo Care
Yes.
Network, and we were
Yes.
the second hospital in the
Right,
nation
right.
to get to join them,
Right.
and that was just such an honor for
It
us.
is, and I'm
you know,
delighted,
Right,
yeah.
and it says a lot
Yes.
about where KRMC was before.
Yes.
But then since that time, we have
Yeah.
just grown by leaps and bounds.
But it also speaks to this institution's mission and vision, and I think Mayo is not easy to just
No.
collaborate
Yeah,
with, and I think the institution sees the spirit of
Right.
Kingman
Yeah.
and KRMC in general, that they feel that this is the right thing to
Yeah.
do, and I'm glad.
Yes, me too.
And that's why I feel that there was something so fundamentally right. I had to come here.
That's great.
I'm
Well,
still
we're-
thinking, wow, Kingman, you know? So, yeah.
Yep, well, we're blessed, and I know you're working now out of the Mountain Shadow
Yes,
Medical Center up on
yes,
Wallapai Mountain
that's
Road with Dr. Keiko.
Right.
It's another individual, I think,
Absolute-
like-minded
Yes.
as far as that whole body
Yes,
that you're
yes.
speaking to.
You know, Sarah Knievel from Pain Management, Dr. Karoom, Dr. Joe, my trusty medical assistant, Barb Williams. I'm so delighted. They're a terrific team, very responsive, you know. There's some getting used to. If you go to a new medical center, there's
Anytime.
a new EMR system, there's a new system of prescribing results, all of these things.
procedures, yeah.
I needed to be trained in all of that, and I still continue to be trained in it. But I am so amazed at the support. Barb is just my right-hand woman.
Good.
I mean, I am absolutely delighted that she's with me. She's just fun and very interested in rheumatology. She's asking the questions. She's asking the right things of the patients as she rooms them.
Oh,
so I'm
good.
very happy. Dr. Keiko has said, you know, we need to do innovative things. So let's look at this
Excellent.
seriously for
Yes.
fibromyalgia and other conditions.
Super. So we're talking about
Rheumatoid arthritis.
arthritis.
Yes, yes, yes.
I was going to say rheumatology. No, that's what you are. So what kind of things lead to
Yeah.
arthritis or the rheumatoid arthritis?
This is an excellent question. You know, this is one of the more frequent things I get in my clinic. Why did I develop this? Why did I get this? No one else in my family has rheumatoid arthritis. Of course, genetics are an important aspect of most diseases, and even in rheumatoid arthritis, there is a higher risk if a first-degree relative has it. So say your mother has rheumatoid
Right.
arthritis, there is an increased risk, and it can vary a little bit, but one of the two things that you can really change, you can't change your genes, but you can pay attention to these two factors. And this is from what we call epidemiology. You look at large numbers of people and you follow them over time, and you see what are the factors that make people have incident or new cases of rheumatoid arthritis. And it turns out two things that have been identified are, one, cigarette smoking. Cigarette smoking actually dysregulates the immunity or the immune system,
Right.
and makes it much higher risk of developing rheumatoid arthritis.
I've never
So if
heard
there's
that before.
one thing, if one thing people can do if they haven't
Quit
developed
smoking.
joint pain, is to quit smoking.
We
Really.
have a high level of that. I'm sure
I know,
you've already
I
seen
know,
that.
I
in
know.
Kingwood.
And the second thing, which is a more recent development, is gum disease, periodontitis. So if you have gum infection,
right.
you want to get rid of it. It turns out that if you have chronic infections like in the gum, it sets off an immune process. It's like a positive feedback, always sort of bumps it up, and you get rheumatoid. So I tell my patients, stop smoking
Right.
and brush your teeth.
Very
Floss
good.
every day.
Yes. Okay. Very good. And now, so rheumatoid arthritis, it sounds like, is different than regular arthritis.
That's right.
Okay.
So rheumatoid is really an inflammatory condition. It has a very distinct pattern than, say, wear and tear. And wear and tear is not quite accurate, but osteoarthritis, okay? And osteoarthritis usually affects the spine, the neck, the lower back, hips and the knees, and the base of the thumb. Rheumatoid, on the other hand, comes on quite quickly. Patients are very, very stiff. They're usually much younger, usually women, all right? In the 5th decade is just when you start to see it. In the knuckles, and in the toes, so the small joints and both sides, so it's symmetrical. But the stiffness is a really key factor. If you're stiff for more than an hour in the morning, you really ought to come and see your primary doctor, and they can refer you to see me, and I can look at your joints in more detail, take a better history, maybe do x-rays and some blood tests.
So that's a good point then. If someone has the arthritis issues, they need a referral.
Yes,
first.
usually.
So they're going to go to their primary care physician, like you said, and ask for a referral so they can come and see you.
Right.
Very good. And I know that most of our physicians are getting to know you, and we've put out a press release and all of that. So if someone wants to learn more about you, they can go to our website, the azkrmc.com, and under Find a Physician, and they look your name up, Manek, M-A-N-E-K, right?
That's right. Yes,
and
thank you.
Pop up, and it's got your whole bio there, your educational background, your picture, that whole thing, so they can learn more about you, and the phone number of where to call.
Oh, excellent. You know, right now, my lists are gradually building up, so if patients need to see me now, this is the time to get in. I have time to spend. You know, rheumatology is what we call very cognitive specialty. There's a lot of thinking, you know, and people think that it's a general public awareness that rheumatology just means the joints, and it turns out no. We think everything from the head to the toe. We ask about the eyes, we ask about the hearing, we ask about the lungs and the heart, because the immune system can really affect all organ systems. So we really are, we take time and are careful about all the systems that could potentially be affected. So it does take time, and I would say, you know, this is the right time to get onto my list. I can, I get to know your case and spend some time with you.
Very good. And back to what we were talking about before the break about that whole body, as you're saying earlier. That's what the rheumatology is, that whole body system.
Right.
So that's pretty, that's awesome to have someone here in Kingman that is able to help with that level of expertise. That's amazing. So you're kind of getting settled in Kingman.
Well, I'm getting used to it. You know, Kingman's very small. It's sort of like Rochester, Minnesota. Rochester now has about 95,000 people, and when I first arrived in Minnesota, well, I don't know, 12, 14 years ago, it was about 80,000. So it grew a little bit. And Kingman's what, 43 or 45?
Well, it kind of depends. I mean, we're almost like 30-something in the city limits, but there's a lot of outlying area But
there's some very cool things. When I first came for my interview, I was taken to Wallapai Mountains.
Good job, you said that well. You've been practicing.
It's like Minnesota. You know, it rolls off the tongue. So I went to Wallapai, and it was February. And I was absolutely stunned, because suddenly I was in cabins and pine trees and elk and snow. And it was so, I mean, completely like Minnesota. And I thought, I left Minnesota to arrive Minnesota alive.
You can drive down the hill and be out of it.
In 20 minutes, I was in sunshine. You're right. You're right. But you know, it's a very interesting cross location. Like I said, it's near Laughlin, it's near Vegas, and you're only 3 hours away from Scottsdale. So I think its location is really quite advantageous. Shall I say?
Absolutely.
It's an advantage.
And you're only 5 hours to the ocean. So
you're right.
No, you can get to the beach.
Right. Yes, my family live in Orange County, so
there you
I
go.
do go home.
Yeah, so you'll be able to get over there. We have children in San Diego still, so so we can get back and visit them in a quick, long weekend kind of thing. So it's nice and yet not be too close. You don't have to worry about Dad and Mom dropping in unexpected.
No,
it's more of a planned trip.
Yeah.
But so that's great, and you maintain your connection still with Mayo.
Yes,
Obviously have that.
yes, I do with Rochester, and of course I know the people at Scottsdale. Again, very, very robust rheumatology departments.
Wonderful.
I think, you know, during my time at Mayo, I was part of the research group, part of the clinical expertise group. So we set up standards. So what does excellence in rheumatoid arthritis care look like? What does excellence in gout look like, and so on. So we have protocols, we have benchmarks and outcome measures, and that over time we will be doing this very robustly through rheumatology at Kingman.
Because it's still kind of new, right?
Well, yeah, you know, the recent paradigm in rheumatology now is treatment, treat to target. That means we used to say, you know, if you improve a little bit with your joint symptoms, that's okay. Well, it's not okay. And what we're now finding out is that if you're rigorous in treating people with rheumatoid arthritis, or if you're rigorous about treating pain in osteoarthritis, if you're rigorous about gout and making sure the uric acid is normal, all of these things help people in the long term.
Sure,
okay?
have a better quality of life.
Exactly. It's like diabetes. You want to keep their sugars under control. With blood pressure, you want to keep their blood pressure under control.
Right.
Cholesterol, you want to keep their cholesterol under control. So why not joint diseases? Why should we accept, you know, an owie joint? So I think we have really changed just recently. I would say in the last, about 4 or 5 years. So it's very recent momentum, if you will, in
Because I think you're right that in the past it's just been, well, I have it.
Yeah,
Gotta live with it.
Yes, no, I don't think that's the right attitude, really.
Excellent.
And even with fibromyalgia, which seems to be a dreaded thing, and it, you know, a lot of people get very disabled, and they're young women primarily.
Well, and it's misunderstood, I think, a lot, right?
Yes, a lot of it is misunderstanding or misinformation. But I think there's a lot you can do with fibromyalgia, and this is where the complementary therapies come into play, because there's many supplements, there's many low-impact exercises, many guided meditations and so on that can really actually nudge the patient to a better quality of life. But most important, they get engaged back in life, back in their families, look at work again. You know, to me that's wellness. It's not just I'm pain free, but that you're a fully engaged individual in your community.
Excellent.
I think that's health.
Yeah, absolutely. Well, as I mentioned, we have a growing complementary alternative medicine group of healthcare providers even in Kingman that are coming together, and Sarah Knievel is part of that, and Dr. Hayden from First Chiropractic. And we have, in fact, they're doing the CAM-BAM, that is a fundraiser for that. They're doing this mud obstacle course to raise money. I know, it's one of those crazy things. I guess because it's in July, so it's hot, and getting muddy probably feels good, I guess.
Mud is good for your skin.
That's what I'm thinking, but I'm planning on just being a cheerleader.
Well, this is very encouraging. So it tells me that Kingman obviously is, like we said, it is a unique opportunity for innovative ways, but we also then start to provide that with a robust platform. And I think going hand in hand with chiropractors is a good idea. They come with a different perspective, and many of them are trained in musculoskeletal medicine, but also acupuncture. So they have the energetic knowledge, as you will. You know, I can't read your energy meridians, but they have a better sense about that. And I'm very glad to be working or collaborating with local providers here. That's a good thing.
Well, and it's wonderful that you're open to that as well.
Absolutely.
So now you mentioned Professor Tiller.
Yes.
Is that right?
Bill Tiller.
Are you going to bring him up to Kingman sometime?
Well, you know, I think that when the time is right, he's 83.
Oh my goodness.
Yeah, he was in the movie What the Bleep Do We Know? I think this was quite a phenomena in 2005, and it was really a movie seriously looking at quantum theory and probabilities and how we have choices at all times. Bill Tiller's work really builds on beyond quantum theory, and you know, word physics scares everybody, but I promise you, I don't know mathematics any better than anyone else.
Right.
It's simply understanding the concepts.
Okay.
And the concepts, once you grasp them, you realize that actually you're always in charge. You've always been in charge.
I think we have a whole nother program to talk about.
Yes.
We're going to have to leave, but I'm so excited you're
Thanks,
here and that
Jamie.
you're on the show. I hope you learned today, because I know I learned a lot. We'll see you next week when I'll have another great guest on the program.